so we can get it for the record. If you can represent your municipality, to stand your name and your municipality, starting with Laura Cream, LAC. I got it already. Go ahead. Yes.
I don't know, because they have no microphone, so it's hard to hear.
That's correct.
All right, the purpose of the meeting is to lay out a plan, to get buy-in from each municipality, in some sort of written form at some time in the next month. If you can get in buy-in from your county, to present the plan, we have the Commissioner Board has come up with the idea of having a facilitator from the county, full-time to, not necessarily full-time, to be access full-time, to oversee the program. The board would act as whoever's on the board, one person from each municipality would vote and run the show. That they would hire the people that's necessary to run the program. They would go over the budget, go over that, and it all talks about a cost, and I think that's a little bit what we need to talk about today. Is what's it going to cost to have a successful program. So I'm going to introduce Scott Haynes, which is our new facilitator, who does an awesome job, and people in the EMS community are very well. Fence Group, what's here? Did they?
We're only two, but Debbie and
Where'd they go?
Pam has some clear Woodbury.
There's 7 municipalities, right? Yeah. Right now. That's true. Yes. Well, that's why we're here. And you could, the American Legion could stay as. Yeah.
Here's the problem, nobody is coming here. We're on the live stream.
Scott,
could you please put the lapel? It's hooked onto this microphone here. I think we could put the lapel mic on. Okay. Oh, there's Mike. Okay, there you go.
hi, it's possible.
Thank you.
You're welcome. I did write down, basically to give a summary because we're throwing a lot of information your way. So what currently has happened is you are all part of 7 municipalities that are part of the MAB, the Municipal Ambulance Board. And back in the spring, Chuck McSweeney, many of you know, who's a business administrator for that American Legion Ambulance Association, approached.
One second, Scott. Yeah, you have people arriving representing Salem, Fence Group. Okay.
So, American Legion Ambulance approached the commissioners saying that their trucks were in disrepair, they were having financial issues, and they needed support. And as is indicated on this document, they said as early as the end of September, they could actually go out of service. So that becomes a
Scott,
question.
one more time.
Yep.
This is Salem.
Salem has arrived.
Joe Hiles is wandering around somewhere. He was in here earlier and walked back out.
This line from shores.
Understood. So with that being said, Mayor Hiles and Commissioner Merkel from Woodstown, understanding that the MAB as an unofficial board, an unofficial body of people who had hired American Legion to cover their towns, was not actively meeting, was not doing well, and apparently it really started falling off in the absence of Jim. He was kind of the charge behind it, is my understanding. The county really going again will offer to be the central figurehead in this group for these 7 municipalities to try to recover this MAB, do what we can do with whether it's American Legion or anybody else to make sure that everybody has ambulance service. In that, they approached the commissioners. The commissioners involved myself and the rest of the county administration, because obviously I'm not an expert in, I'm not a CFO, I'm not an attorney, I'm not any of those things. I'm a good old paramedic. So between us, we've been offered up to support your MAB activity. I'm facilitating this meeting and meetings moving forward to try to get you all to the table so that you don't run into a bigger crisis than you're in now. I'm not sure what anybody actually knows, but with your current vendor, there are many times in the day that there's only one ambulance in service. Doesn't sound like a big deal, but when that same ambulance is being shared between Salem City and everywhere in Pittsburgh and a lot of places in between, it's not really an effective and responsive service. So what we're proposing to do is help reorganize the MAB. We want to get all your names and addresses, who are going to be your representatives, and get you to the table regularly. In the information piece of this, for us at the county level, we were able to, through the administrator, through JK, he was able to actually publish an RFI, not an RFP, but an RFI, request for information or interest, out to people who said they would like to maybe participate in a project. American Legion for one of the respondents. EMSS is another agency that provides service. They provide staffing for Carneys Point Township. And we had some numbers from Inspira that were given to us a year or so ago. They held verbally fast to those numbers. They're a lot higher, obviously, than American Legion or EMSS. So the busy documents in your hands are nothing more than information that was given to us in response to a request for information. There's no official bid on the street, no takeover of anything going on. It's just us trying to get what we can get together to help your towns get a good solid ambulance service in place. Aside from that, through the commissioner board, contact was made with the 3rd district, and in that, some funding was sent toward the county to provide ambulances, physical ambulances, to go to whatever vendor needed and whatever town was in need of a truck to stay in service. The county's got some funding, and we're working towards coming up with some very good, they're used ambulances. A brand new ambulance right now takes months, even years to get. Very good used ambulances through a bunch of channels. So we're trying to do that as well. When the request for information was published, we asked all vendors to give us a proposal using our EMS data. We are the 911 center. We have the data. We know who goes where, when, and what gets transported, and how many, and all those things. We asked them to give us proposals with us providing the ambulances or them providing the ambulances. One agency did, another didn't. Again, it's all a little bit trivial at this point, but what it does is it takes our data and make it not as valuable for you to look at. You can take the information that we have and process it for a little bit. I'd like to get everybody back to the table to say, let's have an official meeting. let's put this together in the form of a shared services group. I don't know if the term is technically coalition or what it is. We want to do a shared services thing. The counties, again, participation in this is just facilitating. We're not trying to run the show here. We want to facilitate you guys having a good, solid shared services committee and making decisions. In that, if one of the towns, whether which town's still interested or not, could take up the role of the fiscal piece with our assistance, again, we're not shoving it down your throat, but we're happily willing to assist in publishing an RFP for a vendor. And again, whether it's American Legion or EMS or anybody else who comes out of the woodwork, when you publish the actual RFP, it becomes beholden to decide who is going to be your vendor for this ambulance service within your towns. Yes, ma'am.
What about those municipalities that have a volunteer ambulances and the ambulances that we send out end up taking over half or the cost? Who's going to absorb that?
So we have no statutory authority over that. You know that.
I mean, is that baked into the numbers? Is that because more costs than we actually have, or is that kind of a black box?
So the numbers that are listed here are numbers that were actually handled by American Legion, by the MAB community provider. And I would anticipate it wouldn't change much.
And then that's not wrong. That cost when you not participate in the
Sure, it absolutely is. But again, it's not something I can enforce a change to.
we're probably subsidizing that.
And that's something for you all to discuss. Now, the number of calls actually answered by the MAB, by the American Legion Ambulance, is what's included. No, from every call they answered and every patient they transported.
Right now, I feel in municipalities that are part of the what is it you would get extra calls?
Now I understand the question. Those numbers are included in that number.
So you're subsidizing
You are.
all of those municipalities.
They're still getting the money from the county for every call they make. What? That, no, that's that $150 is a certificate for that call.
I understand that, and I know you can't force them in, but I've seen the numbers of calls that they're doing against the municipalities, like they are calls that I can have. I don't know.
You know.
I mean, indicating that the way it's around and around. It's really not there to direct us to our children. And continue. There has to be something from, I don't know, I mean, I don't know, say whatever, I'm sure I have a legal procedure, but my sense is that we continue to do it, and if we continue on and on and on, something's going to hit. And it has to change. I don't know what, but it can't continue. And if we allow it to continue, we will never stop. We'll never be any other country or any other municipality which one is set. Why do they work? We still service their which is prayer and resource. We feel like someone in the body, but it's not right. We have downtown Norfolk, something that makes everyone accountable for their costs, not just us. What do we do? How do we approach it? Who do we talk to?
I don't have an answer, and Scott's involved in Scott is involved in EMS all the time. I don't know if there's another model out there that's charging other municipalities. I don't know.
That's the only way we can shoot it. If somebody's going to put a call, then there comes forward.
This is a very good question for, again, this team and possibly taking it up to the state. Will a shared services, an organized shared services committee be able to do that? Can this group, as a municipal ambulance alliance, then bill the other towns for the piece that they're missing? I don't know the answer to that, but you guys as a group tell me that's a question to be asked, and we'll have the question asked. Right now, there's not a legal formation of you guys as a group. You're just 7 towns that happen to use the same guy. There's no format for your agency, your organization. It needs to become something, again, a shared services. I don't know. We've not ever been a part of it. We're trying to help now, but nothing has happened. So are we. And that's why I wrote all of this. This is informational because we're gathering. Yes, sir. They were a private nonprofit, still are. Please don't think I'm chasing anybody out. As a municipality, you have the potential for getting, we throw around DCA a lot, obviously, but, is DCA funding available to a government agency, entity, shared service group that's not available to the private nonprofit? Your contractor, this I can tell you, your contractor that you hire, whether it's American Legion or EMS or any other contractor, would be the ones to do the billing because they are licensed to do that and they have Medicare provider number and they're licensed to the state. Again, this was just a request for information. There was no juice behind this.
Okay.
This was just us gathering. I believe I put in here somewhere in all my lots of words that we need to, you need to publish an RFP with our assistance to ask for exactly what you're asking for now. Provide us what your potential insurance recovery is so that we can pick a sound vendor. So you can pick a vendor who has a good reputation, a good business model that you are comfortable with.
So if you look at it, we have the data for every township that if they were in the shared service agreement, they have an amount they would pay. We have that data, right, which is in all here. So if you take that total number for all the municipalities, and you take your figure, and you subtract all the municipalities that don't want to pay, like in shared service agreement, would it count? Would you guys want to pick that kind of number? Right, we're in it together.
We're already putting $1.2 million out of our budget towards this.
It would be more appropriate for whatever to build a non-participating for the service owner. You're getting your service for your cost. The ones that do not participate, it would be cleaner if the provider built around this group trying to get involved with level the best plan. So, all the way. So, if you guys want to say something, I'm just asking a question.
Probably not.
Well, that's how we, well, so when you tell me, whatever the problem is, why do we want to pick up the path for the one that's on this
Well,
one?
Well, just to be clear, we're not working with this, but this is a municipal function. Has nothing to do with the county. The county stepped up with a $1.2 million. The county stepped up to provide our staff and our facilitator to help you guys work through this. You know, we're not going to go to a countywide system. It doesn't make sense. It doesn't make fiscal sense. But if we get 7 municipalities and later on, once they see this is functional and it's working, and maybe we do build the other, I don't know if that's even possible, but if we,
But you would have to put that in your agreement. You might have to, not necessarily in your agreement, but you would communicate that concern to the provider that you
JT, you want?
feel that
I need to make sure that I can
you can build
sitting behind.
If people didn't know this, JT Ridgway, he's our administrator.
So I just make sure I understand. The issue right now is the number of transport calls. You guys funding this don't want to necessarily fund to be responsible to the other.
Have their ambulance, it's like my girl has function, yeah, that's one thing, but it's the ones that say you don't want to contribute anything at all, you have your ambulance, and they make 10% of the cost, and what they have to rest. So there is a distinction, like, it's not all mutual aid, it's the ones that are just riding along without being part of the organization or having their own staff. And the other thing is, when, an ambulance is calling out, you pay them $150
No, we don't pay them. We pay whoever responds. So if the MAB, the municipal ambulance squad responds, they get the money, not the township. Let's say Alloway, for instance, you get a call on Alloway. They fail to respond, we respond, we get the $150.
Whoever how, if they're not, if it's not willing to step up, how,
They don't.
yeah, they don't.
That's a great idea. So this is why this is a team effort now. JT just had a great idea.
So it's just us and Scott, there's a way we get Scott to the transport calls, who is responding and where. If you trust your RFP, right now, it's kind of like a long stop. But if you break it out to, okay, these are the jurisdictions, and there's the price per response to those transports, and only those jurisdictions that need to be provided with the buffer to the other county. That's all we have. But then for your purposes, the number of transports within your town that they responded to, you can put that in the RFP to try and control some of the issue. And this is good, as Scott said, this is good that we're having this dialogue. But good municipalities, like that, county administration, so trying to understand the issue. We don't know. So I think that there is a market that we can come up with. Will craft the RFP, so like that interaction. As to building, the insurance company, yes, we want to make sure, but I think when we start with this, if we are about it, we ask that they, whatever you do, but including your price, to try and do that of all on the revenue that you're going to receive, even the county contribution, and the state insurance billings, that we call 5%, but I can tell you, following the structure is what we got.
So I think what JT's driving at right now is we're going to unbake those numbers with the RFP to make sure that you're getting what you pay for and not paying for your neighbor's work. There have been times,
Yeah,
not all the time.
so the expectation that we have is that they've got to do all these things around the window. But it doesn't seem like it's been working out like that time. We haven't come up with anything else. But for that,
So the mutual aid program as it exists in the county, the volunteer squads that still exist, our paid squads and our neighboring counties, volunteer paid squads, have stepped up and filled those gaps. On the other side, it's basically the same mutual aid service that's creating the problem that concerns you guys financially. It's that mutual aid piece that's difficult. But, and I completely understand this concern. We've had it right in this room before. You know, why should you guys pay for a town that's not participating? I completely understand it. I like the fact, and again, we have a team now. Hopefully we can figure out a way to craft an RFP to an organized group of you guys to address that concern.
Scott, if you'll
Jump
open
in
with
back.
it. We're going to adjourn as a pre-order meeting in a second here. And then we'll keep this as a working group. Stay, please. And we can have all this discussion, how we're headed for the RFP. Also, I know Scott mentioned it, but we got Senator Bertuccelli went to bat for us. We got $350,000 to purchase these ambulances. We've got a line on some very good products, and we're working on that. Where it's actually the county can buy them and either lease it or some sort of thing back to U7 municipalities. So that's an expense right now for some decent ambulances that will give us a kick in the butt to keep going and doing well. So as far as the pre-order meeting, we're in that now. Can I get a motion to end the meeting? To adjourn? Have a motion, a second. All in favor, please raise your right hand. And it's unanimous. We're done the meeting right now. You can continue on as a working group. One of the problems I've seen